The global aging population demands competent nurses for end-of-life (EOL) care, yet traditional curricula often fail to prepare students for palliative care complexities. Simulated Clinical Immersion (SCI) emerges as a promising solution, offering realistic, hands-on learning experiences. This study investigates SCI's effectiveness in preparing nursing students for EOL care in older adults. Research design. A quasi-experimental pretest/post-test design was employed with 128 fourth-year nursing students. Participants were assigned to an intervention group with high-fidelity SCI and structured debriefing or control group with traditional lectures. Data on EOL care knowledge, clinical self-efficacy, and perceived simulation effectiveness were collected and analyzed. Results. The SCI group showed significant improvements in EOL care knowledge and clinical self-efficacy, with increased perceived simulation effectiveness. The control group showed no significant changes. Large effect sizes in the intervention group highlighted SCI's substantial impact. Conclusion. SCI is a more effective strategy than traditional lectures for preparing nursing students for EOL care in older adults. High-fidelity simulation is recommended in nursing curricula to foster essential knowledge, confidence, and competence for compassionate palliative care. Introduction. EOL care is a cornerstone of professional nursing, requiring specialized knowledge and skills. Despite this, nursing students often graduate with insufficient knowledge and low self-efficacy for comprehensive EOL care. Simulation-based learning, SBL, especially high-fidelity simulation, has proven effective in fostering clinical competency. However, few studies have examined the impact of SCI, a comprehensive form of high-fidelity simulation, on learning outcomes. Aim of the study. This study aims to evaluate SCI's effectiveness in preparing nursing students for EOL care in older adults, focusing on knowledge, clinical skills, and attitudes. Methods. A quasi-experimental design compared nursing students exposed to SCI with a traditional lecture-based control group. Participants received standardized didactic content on palliative care and EOL principles. The intervention group engaged in SCI, while the control group received lectures. For instruments assess knowledge, self-efficacy, and preparedness for EOL care. Ethical considerations. The study received ethical approval, ensuring participant rights and voluntary participation. Informed consent was obtained, and participants could withdraw at any time. Intervention Group, Simulated Clinical Immersion, SCI. SCI was structured with pre-briefing, simulation, and debriefing. Each simulation involved 8 students, with 4 active participants and 4 active observers. The scenario focused on a critically ill older adult, requiring symptom management and goals of care discussion. Debriefing process. The debriefing session, led by faculty experts, facilitated student reflection and learning. Feedback was standardized across sessions, ensuring consistency in content and focus on targeted competencies. Control group activities. The control group received didactic, lecture-based instruction covering identical learning objectives and theoretical content as the SCI group, without clinical simulation or high-fidelity experiential learning. Data analysis. Data were analyzed using SPSS, with descriptive statistics summarizing participant demographics and t-tests and chi-square tests evaluating differences within and between groups. Effect sizes quantified the practical significance of findings. Results. The study included 128 nursing students, with a slightly lower mean age in the SCI group compared to the control group. Both groups had comparable baseline knowledge, but the SCI group achieved significant improvements in all domains of EOL care knowledge, particularly in communication and psychosocial support. The control group showed no meaningful change. Discussion. SCI demonstrated superior outcomes in knowledge, self-efficacy, and preparedness for EOL care compared to traditional lecture-based instruction. This superiority is attributed to Kolb's experiential learning theory, providing an active learning cycle with concrete experience, reflective observation, and abstract conceptualization. The controlled yet realistic environment of SCI likely contributed to significant gains in self-efficacy, a critical factor for transforming theoretical knowledge into clinical readiness. Implications for educational practice. The study's findings emphasize the importance of integrating high-fidelity simulation in nursing education, particularly in EOL care. Structured debriefing is essential for transforming simulation experiences into meaningful knowledge and professional growth. Nursing programs should embed high-fidelity simulation throughout the curriculum, ensuring progressive development of competencies in communication, ethical reasoning, and interprofessional collaboration. Conclusion. SCI substantially enhances nursing students' preparedness for EOL care in older adults. An immersive, experiential learning approach yields superior outcomes in knowledge, clinical self-efficacy, and perceived readiness compared to traditional didactic instruction. The structured debriefing phase is critical for deep, reflective learning and professional growth. Nursing education should consider high-fidelity simulation as an essential component of palliative care curricula, investing in technology and faculty development for high-quality, evidence-based simulation and debriefing. SCI bridges the gap between classroom theory and clinical practice, equipping students with holistic competencies for compassionate, confident, and competent care. Future research should focus on long-term skill retention and its impact on patient outcomes in clinical practice. Limitations. The study was conducted at a single academic institution, potentially limiting the generalizability of findings. Outcomes were measured immediately after the intervention, without assessing long-term knowledge retention or clinical performance over time.